Hi, everyone. My name is Tony Hoang. I'm the Deputy Director at Equality California, and I'm here to talk about PrEP. So who knows what PrEP is? So folks know that, in 2017, there are nearly 1.2 million Americans currently living with HIV and an estimated 50,000 new cases of HIV transmission every year. And sadly, most of those new cases are gay and bisexual men of color. Like Cornelia said yesterday, if current transmission rates continue, 1 out of 2 gay or bi African-American men will be diagnosed with HIV, and 1 out of 4 gay or bi Latino men will be diagnosed with HIV. And we know that transmission rates are going up for trans women of color as well. So now more than ever, we need to increase the awareness of PrEP, which stands for pre-exposure prophylaxis, which is a new tool. FDA sort of approved it in 2012, once-a-day pill that sort of reduces the risk of transmission up to 99%. This, along with tools like treatment as prevention and testing, give us the tools to really get to zero transmission and eventually end the epidemic. So that's why in 2016, Equality California launched its public education program, Take It, I'm PrEP'd, which consists of 3 buckets. 1, healthcare trainings, 2, community outreach, and 3, communications. With the healthcare trainings, we really wanted to look at the provider side. I think folks see, PrEP ads all around town, in major metropolitan areas, but really folks aren't focusing at the providers. When we did our research, we know that a lot of doctors don't know anything about PrEP. So when we have someone going to their doctor, the doctor doesn't know what to do. So what we've done is create an LGBTQ cultural competency training, focusing on underserved areas. A lot of doctors are good with getting an LGBT cultural competency training, so we insert the PrEP module within that training, showing that medical providers can feel comfortable talking about health topics for LGBT folks, including HIV prevention and PrEP. Throughout this year, we have trained nearly 54 health clinics across the state with 636 healthcare providers, and we really wanted to focus in on areas that don't have great health access and equity, particularly the Central Valley. This is one of our sample slides from the training. We've had really great results with this training. Particularly, one example would be in Madera County, which is a rural county in the Central Valley. We had the Department of Public Health start a PrEP outreach to rural farm workers, particularly trans women of color out in the Central Valley. In addition to the healthcare clinic trainings, we've been doing a lot of community outreach. We didn't want to reinvent the wheel and insert new programs. We wanted to give folks capacity. We had a really great number of organizations doing work within their own communities, particularly the Minority AIDS Project, Black AIDS Institute, and Bienestar. So we wanted to give them subgrants to increase their capacity to do PrEP education in their own communities. We've also been meeting folks where they're at. By the end of this year, we'll be at nearly 16 prides throughout the state, training hundreds of volunteers and thousands of conversations around PrEP. We've also been having various club nights, places like Hamburger Mary's, where we, in addition for drink tickets and swag, we have folks take a brochure about PrEP and giving us their email to get additional information about PrEP. So we hand things out like lube and condoms and pill containers and sunglasses and t-shirts. And last but not least, we've been really creating a diverse set of materials to communicate with the general public about PrEP. We've created brochures for Spanish speakers, women, both trans and cis women, medical providers, really educating in a simple, digestible way about sort of the top lines about PrEP and then linking to resources if they want to find out more. We've been blasting our email list. We have nearly 800,000 emails, so we're educating the general public, having their friends know and educating them about PrEP, but also really focus in on this group that we've sort of built up of folks wanting to find out more and giving them all the information that they need to sort of get PrEP, whether it's cost, where to find it, things like that. Through social media, we've reached up to 850,000 impressions. But the thing that is most interesting is that we started to run ads on dating apps, things like Grindr and Jack'd and Scruff, where we were sort of really been able to target specific areas that have been underserved. We've reached nearly 2 million folks on Grindr itself. This is one of our ads. But it's really funny when your friends see your organization on Grindr. So But overall, I mean, we're really proud of the impact that we've had. 3.6 million folks just through digital. We really want to continue to expand the program, and we're hoping that everyone in this room, brings PrEP into their own programming. It's 2017, and we have a unique opportunity to bring HIV transmissions to zero, but we really need everyone to take PrEP. It needs to be like birth control, and that's the only way that we're going to end the epidemic.